Welcome to the College of Legal Nurse Consulting's videogram on legal nursing and malpractice. And in lieu of Dr. Dominic Fleury, the course instructor, my name is Mark Moran. I'm the Assistant Executive Director at AIHCP. This is a pretty basic video on malpractice. So I'm just filling in for Dr. Fleury in regards to going over the core concept of what malpractice is and the role of a legal nurse in that procedure. Dr. Fleury himself has been a legal nurse in the past and has worked countless hours in the field. So he is also your instructor. And if you have questions about malpractice cases as a legal nurse, he would be your greatest resource and asset. Legal nurses themselves play a key role in these cases as part of a legal team, or most commonly, they serve as an independent contractor offering services either to the plaintiff or the defendant. So they can work for a legal team that's representing a physician or a healthcare organization, or they can also work with an attorney that's representing the patient themselves. And because they have an expertise in nursing itself and procedure within healthcare, as well as a legal understanding of procedure with malpractice, many legal nurses are hired on by law firms to do research or also serve as a variety of ways as an expert witness or also as an important component within the team itself. Sometimes a case will be presented to a legal nurse, and a legal nurse consultant will review the background of the case and see if it's even worthy for the attorney to take this particular case, to see if it has any value for the firm to proceed, or if it would be not in the firm's best interest in itself. So medical malpractice occurs when a healthcare professional or a facility causes injury to the patient through negligence. The negligence can be through diagnosis, by poor treatment, or in aftercare itself. A legal nurse consultant helps the firm discover if there's been a violation of standard within the particular care that the patient was receiving, if the injury was due to negligence in itself and how the procedure was finalized, and if the injury itself resulted in significant damages. And within these significant damages, obviously, it would have to involve something worth the time of the firm to take the case that would result in a beneficial sum of funds of money for compensation for the individual, the patient who suffered the negligence or the violation within the standard of care. Various examples of medical malpractice include failure to diagnose or a misdiagnosis of something, misreading or ignoring lab results, performing unnecessary procedures, various surgical errors, prescribing the wrong medication or the wrong dosage of that medication, post operation care, poor care of an individual recovering from surgery, premature release from a medical facility, improper patient documentation, improper testing itself. So these are a few things that can occur where medical malpractice can pop up in regards to healthcare professionals and patients themselves. In some cases, it might just be a random nurse. Other times it might be the attending physician, or it might be more organizational, more at a higher level, or a collective organizational level. So medical malpractice can happen. It does happen. And this is why nurses and physicians on the other end of the coin need to protect themselves with good insurance. They need to look out because sometimes proper care is given and the patients are merely angry at a particular outcome that they did not foresee, and then a case comes up and it has to be seen if that case will go forward or not. So many times the lawsuit is perceived by the patient as something that went wrong and not something that really went wrong. So how can physicians, nurses, and other healthcare professionals prevent the potential of an unneeded malpractice case emerging, or even just one just surfacing and then being dismissed with all the headaches that come with that? Well, better communication is very important with the patient. Also, a nicer bedside manner and a lot of compassion and care and taking time for the individual. All of this can go a long way in preventing an avoidable litigation. And many cases, because of this, go forward because an individual is upset with how the doctor spoke to them, or they perceive that they were told this and this is really what it was, and it leads to this miscommunication and eventually to a potential legal headache. So it's not only an issue of humans make mistakes, but also that individuals can perceive a mistake that may not actually exist in itself. So if you're a registered nurse, consider taking your medical knowledge to the legal arena through the American College of Legal Nursing itself. And you can earn with AIHCP an online certification. It's independent study. It has CE credit for nurses. The state boards of California and Florida directly approve these courses for registered nurses, and it presents to the nurse a 4-year certification in legal nursing, and then you'll be able to utilize that as an independent contractor or work with a firm itself. Below is our link for our legal nurse consulting program. Our phone number is 330-652-7776, and our email is info@aihcp.org. So if you're a nurse and you're interested in possibly becoming a legal nurse consultant, please review the program and see if it meets your academic and professional goals and needs. Thank you and have a good day.